Good morning. Another topic for today. Today, we're going to talk about the human body. So let's get started. Here we go. So when we talk about the human body, we got to talk about the function of muscle and then getting into detail when we talk about the musculoskeletal system to start. So what the heck is the point of that? So this keeps us from walking around like a pile of mush. It gives us shape. It provides the ability for movement, protection of to the organs that are on the inside. You think about, if you really think about your body and all of the muscles and all of the skeleton and bones and everything and how tough they are, think about what they protect on the inside. Well, let's talk about that stuff. So let's get into the skeletal system. Starting with that, it stores calcium. When we store calcium for it to be utilized later. So this also helps create blood cells in the bone marrow area of the bones. Now let's talk about that, the bones. What does it consist of? The bones, the muscles, the ligaments, and the tendons. And don't forget the cartilage. So, and when we really start talking about the different areas, we break it down even further. So we talk about the axial skeleton. This is the foundation in which that gives something for the legs and the arms to hang off of. So what does the axial skeleton consist of? Just like we see, it consists of the skull, the spinal column, and the thorax. So let's look specifically at the spinal column. You have 33 vertebrae in your body. These vertebrae are designed, they're very tough. They're designed to protect a very important part of our body that we need to function, the spinal cord. So it's divided into 5 sections: the cervical area, the thoracic area, the lumbar area, the sacrum, and the coccyx. Remember that coccyx is that tailbone. So if you've ever fallen down onto your behind and you're like, oh man, I hurt my tailbone, that's the bone you're talking about. So more on the axial skeleton and the thorax. So what is this? The heck is the thorax? Let's look at it. This is formed by 12 pairs of ribs. And in that cavity that is created by those surrounding ribs, you have the heart, the lungs, the esophagus, in the great vessels, like the aorta. You have the thoracic aorta that is a gigantic vessel. So if that's damaged, somebody can bleed out very quickly. So front of the thorax is the sternum. At the base of the sternum is the xiphoid process, the little tip down at the bottom. And then the ribs. So now talk about the appendicular skeleton. This is all the arms and the legs, their connection points, and the pelvis. That includes the upper extremities, the pelvis, and the lower extremities. Talking about the skull, now you have the skull or the cranium, you can call it also. Think of skull, it's easier. We'll start with, what is it? The orbit, which protects your eye and the vessels and the nerves that come through for your eye. The upper jaw, it's called the maxilla. Well, if you haven't guessed it yet, we're going to talk about the lower jaw. It's called the mandible. And in the foramen magnum, so as you see in the diagram there, it's pointing to that hole in the base of the skull. And if you think about what that hole's for, that's where the spinal cord comes down. And right where that spinal cord is the brain stem with that medulla. So if you have somebody that has a head injury with increasing pressure, the brain has nowhere to go. It's going to take a path of least resistance. We'll start putting pressure down towards the foramen magnum, which will push that brain stem, and that's where you will start to have irregular breathing patterns and everything that go with it. So important. The big hole called the foramen magnum. So let's talk about the upper extremities. What do we have there? That's from the shoulder girdle to the fingers. So we have the humerus, the top bone, the radius and ulna, and the carpals and the phalanges. We'll talk more about that in a minute. Top is the clavicle. If you feel right, as you see on the diagram, on the skeleton, you feel where the clavicle is. It goes all the way from almost the point of the shoulder right to the sternum. So it's quite long, quite long. And actually, one of the big problems people have when they're looking for that mid-clavicular area, they forget how long that clavicle is. So they misjudge it and they go too medial towards the sternum. So keep in mind how long that is. The scapula is your shoulder blade. This is if you have a fractured scapula, it takes a lot of energy to fracture that. So think, if you have a fracture, if you suspect fractured scapula, what else is fractured? Usually is a case. It's not really funny, but it is humorous. Anyway, that's what happens when I stand in a room by myself doing our video recordings. Silly jokes. So humerus is the long upper bone, which we briefly talked about. The ulna and the radius. The radius is if you're holding your palm facing forward, where it's the outside bone of your forearm. That is where we're usually feeling a pulse, a radial pulse. The ulnar side has a artery that goes down through that, but very difficult or impossible in most patients to actually feel with just your fingers. So, all right. And then you have in your hands, you have the carpals, the metacarpals, and the phalanges. So remember, I remember this by, I drive a car with my hands, carpal, metacarpal, phalanges. All right. Talking about the pelvis, the structure of the pelvis is a very tough, very protective area that protects a lot of big blood vessels. So if you have energy that has broken the pelvis, you have energy that has damaged the vasculature, nerves, and that are inside that pelvis. So keep that in mind if you suspect that, think bleeding. And the pelvis is made up of the sacrum and the coccyx on the backside. It's closed by the three bones. This the sacrum, the two pelvic bones, as you see on the outside there, and the pelvic bone is formed by the fusion of the ilium, the ischium, and the pubis. The ilium are the big bones that you actually feel protruding. And then the pubis is the front bone. All right, in the lower extremity, what do we have in the lower extremity? We have the femur. That's the thigh bone. This connects to the acetabulum and the pelvic girdle, and that's by a ball and joint socket. So remember, a ball and joint socket is one of those joints that we have a 360-degree movement to and outside, so multiple planes of movement with it because it's rolling in that socket. So that's a femur. So femur injuries could potentially come with a lot of internal bleeding with that. That's also something to suspect, some significant bleeding. You do have a femoral artery in there, which you could quickly bleed out of if it is severed. Then the patella, your kneecap. Everybody knows where the kneecap is. So this is actually, as we get in, move forward, get in down through trauma, and we talk about injury management and splinting. This is something that actually in a pre-hospital environment, we are able to pop back in. Stay tuned, more to follow. The tibia is the anterior bone. That's the bone you can feel on the front of your shin. It's your shin bone. There you go. We'll go with that. And then the fibula is that bone that's in the back. That's just so part of the support of the lower leg. It also gives you the ability to twist and move and articulate with the ankle. So when you bend your ankle, you'll feel both of those bones will articulate with the ankle. Speaking of the ankle is a hinged joint. This allows flexion and extension of the foot. Sorry, just checked in to make sure my recording is still going. So that gives you extension of the foot. So in the foot, you have the bones of the foot. You have 7 tarsal bones, 5 metatarsal bones. The 5 metatarsal bones, they form the substance of the foot. So, and then you have the phalanges or the toes on the end, as you see kind of laid out in the diagram below in the X-ray. All right, talking about specific joints now. So what are joints? What are joints? Joints are 2 long bones that are coming into contact. It's a hinged joint. It's motion restricted to one plane. So that's like your elbow. You could bend at the elbow, but you can't, like your shoulder, where you could do all that different rotation, and you aren't able to do that. It's also a ball and socket joint, but it doesn't have that 360-degree rotation. All right, so in the hinge joints, there you go. That's actually what we just talked about. So, and then we talk about the ball and socket joints. That's what we kind of already talked about. That's the hip, that's the shoulder. So now we talked about the bones. Let's talk about moving towards the outside. Let's talk about the muscles. So if you think about it, if you haven't figured out by now that the human body is an amazing thing, I say that over and over again. It is. Think about what it takes for just simple movements. There's over 600 muscles in your body that are attached to bone. That's just attached to bone. That's not how many muscles you have in your body. That's what are attached to the bone, though. So the physiology. So when the muscles contract, they're active, and when they relax, they're passive, right? But they allow movement. But one of the things of increased muscle use, being a runner, or you're lifting weights, or you're working heavy, it produces heat. So that's why on a hot day, our cooling mechanisms kick in, and on a cold day, you might be warm because of the heat you're producing. But in somebody that's approaching hypothermia, their body's response to that is to shiver, to create that heat, to keep us warm. So in the body, there's 3 types of muscles. There's the cardiac muscle, which is absolutely amazing. There's skeletal muscle, the muscles that give us the ability to move. And that smooth muscle, that muscle that we don't have to think about to use. So when we talk about the skeletal muscles, those are the voluntary muscles. These are the ones that attach, those 600 muscles that attach to the bones. This forms the major muscle mass of our body. So when we're not just skin and bones, which not many people are just skin and bones, when you have the muscles underneath and the adipose underneath, that gives a shape to the body. So, and then the skeletal muscles are responsible for movement. And this is also under conscious control. So we tell us to open our hand or make a fist. That's conscious control. Involuntary muscles, those are the smooth muscles. Those are found in the gastrointestinal tract, in the urinary system, and the blood vessels. Yes, the blood vessels have muscles in them too. So or surrounding them. But they control the flow of materials or fluids through these structures, and take the blood vessels, have the ability to dilate and contract, that is controlled by the body. So this is the automatic muscular function. There's no conscious control over these, and it responds to stimuli such as heat, cold, and stretching. When with stimuli that ouch, it's hot, you're going to pull away. That's an involuntary movement. That's your body's response. So, but more so in this aspect when we're talking about the breathing and we talk about digestion, and that's the involuntary. So, and in a cardiac muscle, these are only found in the heart. This is what amazes me about this particular type of muscle. This is also an involuntary muscle, but the heart has its own blood supply. And they are supplied by those coronary arteries that actually fill when the heart is relaxed. So then they fill up, then when they contract, there you go. They're not filled. There you got the point. You got the point. So, and then, so the cardiac muscle actually is very, very on purpose greedy. It needs blood because it can only tolerate that interruption for an extremely short period of time. If it goes longer than that, you start to lose heart tissue and heart muscle. But each of those cells in that heart have the ability to contract on their own. That's called automaticity. Automaticity. Amazing. All right, moving away from the heart, let's move to the lungs. So let's talk about the respiratory. And we have briefly talked about this, actually more in depth talked about this when we talked about airway management and airway EMT, but just to review, the respiratory system in the EMT, the upper airway is from the mouth to larynx. So in that you have in the pharynx, you have the nasopharynx, the oropharynx, and I can say this, laryngopharynx. It's early in the morning. I still am only on 1 cup of coffee. So, and in the laryngopharynx, you have the larynx anterior and esophagus posterior. So when I say that, that means in the front where you could feel your Adam's apple, that's your anterior. And behind that is the esophagus. And yes, I need to change the formatting on my slide because I see they moved the S. They shouldn't have done that. Anywho, and then let's talk about that posterior view, the epiglottis. I'm sorry, not the posterior. We're talking about the epiglottis. That's the little flap that covers the trachea in that glottic opening. So that prevents fluids, bacteria, and food, and anything that doesn't belong in the lungs. It's designed to protect it from that happening. So muscles in breathing, we talk about the main muscle is your diaphragm, which is the primary, and the intercostal muscles. Those are the muscles that are in your chest. Those are the main muscles we're using, mainly the diaphragm. That actually, when that contracts, it goes down and increases the size of your chest. So when you start having difficulty breathing, you need extra help. So accessory muscles kick in, which you probably are using all the time. You just can't see them. But when you start seeing them, this is what they look like. You have the trapezius muscles are incorporated to it. Everything's trying to draw the chest and make it larger. So the scallions and the sternomastoids, you will see. And then in a patient's face, obviously, with a respiratory distress, you're going to see other signs. More to follow. So what happens in inhalation? You take a breath in, your diaphragm contracts, the intercostal muscles contract, and your chest cavity becomes larger. So if you think your intercostal muscles moves the ribs away, so it creates a larger space, and then the diaphragm moves down. And then by this, remember diffusion, going from a higher level to a lower level. So what's happening, we're making a larger space, so it's creating a negative pressure. And by that diffusion, It's a higher pressure on the outside. By diffusion, that air will flow into your lungs. And then when we exhale, it relaxes, the diaphragm relaxes, the chest cavity relaxes, it gets smaller. Now it's because it's getting smaller, it's actually creating pressure as it comes back in. So we want to normalize pressure and diffusion, that air will go out. So it goes from higher to a lower pressure. All right. In the respiratory system, the function, this is to provide the body with oxygen and eliminate carbon dioxide. With ventilation is different than respiration. So they're interdependent functions of each of the respiratory system. If one's failing, the other one's not working. Keep that in mind. So ventilation is inhalation, exhalation. That's the process of it. That's a mechanical process of it. So when we take a breath in, by the mechanical process of it, we breathe. All right. In respiration, this is where the whole process, the chemical level process happens. So the stimulus to breathe is found in that medulla, that brainstem, in the brainstem. This is in a normal body. It's actually driven by high levels of carbon dioxide. And as some disease patterns and some disease processes like COPD are chronically high with carbon dioxide, so there's a backup system with a hypoxic drive. Hypo meaning low, oxic means oxygen. So that actually monitors the levels of low oxygen and stimulates the body to breathe. So with this prolonged use of high levels of oxygen with a COPD patient, in theory, could cause them to their respiratory rates and quality and efforts to actually diminish, because their body is actually only monitoring that oxygen level. In theory, that takes a while to happen. You will not see that in your ambulance for the amount of time we're spending with them. So if somebody needs oxygen, give them oxygen. So, all right. And we know about BVM, Airway Management 101. This is an art form. Remember, the best way to deliver goods, to get a good seal, is with one person on just the mask. So 2 hands to do it, and the other person with another person ventilating. So in respiratory physiology, the exchange of oxygen and carbon dioxide are happening. This happens down at the across membranes of the lungs or cell, down at the level of the alveoli. So tidal volume, this is how much air we can get in one breath, just one breath. All right, moving to the circulatory system. So in the circulatory system, we talk about the heart, we talk about the blood vessels, we talk about blood. Well, let's rename those. The heart, let's call it the pump. The blood vessels, let's call it the tank. And the blood, let's call it the fluid. The gas, the fuel, let's call it the fuel. That's the best one. So heart, blood vessels, and fuel. So let's do this. So what arteries carry oxygenated or carry blood away from the heart? Most arteries carry oxygenated blood away from the heart, except for one artery that's carrying deoxygenated blood away from the heart, and that is the pulmonary artery that goes from the right atrium or the right ventricle to the lungs. And then also, then when we feel our pulse, if you take the time, we know how to find a pulse by now, radial pulse. That's what's happening. So this is actually an active pressure when the heart beats. That's what you're feeling going through there. So veins, they return oxygen depleted blood back to the heart, and like the arteries in the lungs, the pulmonary artery, the pulmonary vein is oxygenated blood because it's returning with oxygenated blood from the lungs into the left side of the heart. So capillaries, This is where they're tying in together for that transition from arteries over to veins. And in the process of those capillaries, that's where the exchange is starting to happen. So in normal circulation in adults, blood enters the organs through the tissues and arteries from those capillaries, and then blood leaves the organs through the veins. So it'll be capillaries on the artery side, so it comes in artery, arterial, capillary, venule, vein. That's the process that it's happening. So little note, which is amazing. If you really think, if you were to take all of the blood vessels out of the body, all the veins and arteries and the capillaries, and you laid them side by side in length, it would go 60,000 miles. 60,000 miles. Amazing. Then in our small body, we have that much vasculature. So that's the tank. Let's talk about the fuel, the blood that's on the inside. What the heck is in this blood? The function of this blood, one of the main things is to fight infection. We'll talk about that in a second. And the other thing is to transport oxygen. Ding, ding, ding. We don't have that working. Something's wrong. The patient's not going to be healthy. That's bad. So also it transports that waste product, that carbon dioxide, back, trying to get it out of the body by breathing. So the blood will help control pH. Our biggest buffer we have in our body is our breathing. So that's our body trying to maintain that homeostasis, that balance that it wants to do between that pH side and that acid side, wants to be in a happy space. And another function of the blood is to get rid of the waste nutrients with our different filtration systems we have in the body, with our kidneys and our liver, mainly our liver for blood, and then also clotting. So the clotting comes in very important when it comes to trauma. On the other hand, it's also very important when it comes to heart attack and also stroke. So on both ends of it, it could, one, you want clotting, two, you don't want clotting. So that's where we're at. So blood composition inside the plasma, as you see in the bag there, that's the color. The fluid that carries, that's the transport system to carry the blood cells and those nutrients in the body. And the red blood cells, those are called erythrocytes, if you want to get technical. But these give the blood its color, that red color we say. That's why we call them red blood cells. But their job is when to carry oxygen to the organs and then carry carbon dioxide away from the organs. So oxygenated blood, when it's saturated, will be brighter red, and when it's desaturated, when it's venous, will be darker red because of that. Is it oxygenated or is it not oxygenated? All right, white blood cells. This is your infection fighter right there. These are your leukocytes. With leukocytes, that's why one of the first things they do if they suspect somebody with a fever, they don't know why. One of the first things they do is they do blood testing and look at what the white blood cell count is. So, and then we talk about clot formation, and we briefly talked about it. Yes, first, we want clotting for trauma. We do not want clotting for strokes and heart attacks. But those are your platelets. Those are your platelets. That's what does the clotting function. All right, so that's the fluid, otherwise known as the fuel. So we talked about the tank. We talked about the fuel. Let's talk about the pump. So the heart is a muscular organ about the size of your clenched fist. Not my clenched fist, your clenched fist. So your clenched fist is about the size of your heart. All right. Each side is divided into, you have 4 chambers, but you have the upper sides are the atrium and the lower sides of the ventricles. But then you break those into left and a right. So you have your left, the right side. So you have, as blood comes through, it comes into the right atrium, into the right ventricle, through the pulmonary artery to the lungs, through the pulmonary vein back to the left atria, and then into the atrium, excuse me, and into the left ventricle, then out to the body. All right. The heart, it's made of we talked about the amazing cells that are in the heart. So basically the heart is two separate pumps working together to pump the blood. So, and then each side of that heart is divided by a septum. So that's the right and that's the left side. All right, so in the septum, it prevents the backflow of blood with the valves that are in the heart. So we talk about valves and you hear like a regurg or a murmur and that kind of stuff. That's what they're hearing, is that backflow. They'll hear a click and like a whoosh when they're listening. If you're listening to ultrasound, that's what it would sound like. So, but those valves are to keep the oxygenated and deoxygenated blood from mixing. Same story. So, all right. And then you have your heart. So let's take a ride. Let's be a drop of blood for a minute. So you're going to come in and through that superior and inferior vena cava, right? Those are your biggest veins in your body. And you're going to come into the right atrium. You're going to go through the tricuspid valve. You're going to go into the right ventricle. And when you're done with the right ventricle, you're going to go out, up, and through the pulmonary artery into the lungs, get happy with lots of oxygen and get rid of all your carbon dioxide. Then you're going to come back through the pulmonary vein as oxygenated blood. There it is. Into the left atrium, into through the mitral valve, into the left ventricle. And now you're ready for travel through the rest of the body. You're going to do that out through the aorta. So think about everything that goes into this heart. It only takes one of these areas for something to go wrong for it to really throw a wrench into the works. More to follow when we talk about cardiology. All right. So in your heart, normal for an adult is 60 to 100 beats per minute. What they measure when they look at a heart and they see how it's beating, they measure stroke volume. This is how much blood is moved in one beat. So it's important we know about that because we got to look at cardiac output. This is the amount of blood that we move in just 1 minute. So that would be the heart rate times the stroke volume. That's where we get the cardiac output. So if we look at that, why that really ties into when we're talking about that compression fraction ratio, when it comes to, probably said that wrong, but you get my point when I tell you with CPR, when we're doing compressions and we're building that cardiac output, because now we are causing the heart rate and the stroke volume manually with compressions. So the bigger we build that till we get to that level of cardiac output that will maintain, that's where we want to keep it, because every time we stop, it falls back off. All right, so in the human body, if you really think about it, 5 to 6 liters of blood in the human body, there's really not that much. If you have somebody that's heavily bleeding, they will bleed that out very quickly. So that has its own electrical conduction network and the ability for the automaticity. So it can generate its own pulse. The blood pressure in the body, this is the pressure that exerts against the pressure in the artery walls. The left ventricles, that's the workhorse. That's what pushes that blood out into the body. And then that's systole. What's the systolic blood pressure you hear? So that's the active, when the heart is beating, that is the number, that top number you're hearing in a blood pressure. So let's look at this. When the muscles relax, the ventricle will fill with blood. That's diastole. Blood in the readings you're getting, that's the high point systolic. The low point is the diastolic. So high point, remember the heart is actively beating. The low point diastolic, that's when the heart is at rest, and that's the pressure that's left in the arteries that you're measuring. Then we're talking about in adults, normal circulation for adults. We talk about perfusion. That's the circulation of blood in an organ or tissues with inadequate amounts to meet the needs of the cells. So if you think about what is the need of a cell, is that cell getting what it needs? That's perfusion. So hyperperfusion is that cell's not getting what it needs. And with this is inadequate blood flow, or the fuel, as I say, is not adequately supplied for some reason or another. So it's not getting what it needs. So the cells will will show you that something's happening with signs and symptoms. That's where patient assessment and paying attention is very important. All right, moving forward, talking about the nervous system. So the nervous system controls voluntary and involuntary activity of the body. Very complex system. So in the nervous system, you have two components. You have the central and the peripheral. In the central, we have the brain and the spinal cord. Brain and the spinal cord. So in the brain, this is the control organ of the body. Hopefully this is reviewed to you. The subdivisions of that are the cerebrum, the cerebellum, and the brainstem. So let's talk about it. The cerebrum that's the largest portion of your brain. This controls all of the higher functions, the senses, thoughts, the movements. You have a piece of this taken out and still function. Maybe not the same, but it'll still function. So then the cerebrum, you have the four lobes: occipital, temporal, frontal, and parietal. So you look at the frontal lobe, this is reasoning, planning, problem solving, also a lot to do with a person's emotions and their character. You're gonna get what I'm putting down there. So in a temporal lobe, this is the auditory stimuli, memory, speech. Why is it important we know what each area controls? So when we have head trauma or we have a stroke, we see the damage or the injury happening on that side of the brain. We know what kind of things we should probably look for. Or if we see these things as symptoms, we could suspect there might be an injury to that side of the brain, vice versa. And the parietal lobe, that's the lobe up kind of on the side top. That's the language and touch. And in the occipital lobe in the back, that's vision. Now, the cerebellum, the little piece down in the bottom, that controls your balance and your coordination. All right, and then the brainstem, this controls your life. This is your reptile brain. This is designed to keep you alive. So this controls all your reflexes, the respirations, the heartbeat. You get the point. If you don't have a brainstem, that's bad. You will die. But also, if you have a head injury and we start to see certain signs, we suspect brain injury to brainstem. All right. Some mornings, I do resemble this. All right, moving down from the brain, we're going to talk about the spinal cord and the central nervous system. This is a continuation of the brain. This transmits messages between the brain and that body. In the peripheral nervous system, we have two main portions. We have the somatic and the autonomic nervous system. So the autonomic nervous system controls involuntary actions. So the digestion, dilation of your blood vessels, that area is split into two different areas. The autonomic nervous system is split into two: sympathetic or parasympathetic. Sympathetic is I'm going to run away. I'm going to flight or fight. Parasympathetic slows everything down. Time to eat, time to digest, time to go to sleep. All right. It's sympathetic nervous system. That's the fight or flight. This sends commands to those adrenal glands. Adrenal glands. Yes, that's right. That sounds like adrenaline. You're right. Epinephrine, norepinephrine. Those are the synthetics we created to, as a hormone, to do exactly what epinephrine and norepinephrine do in the body. They are secreted to stimulate the heart and blood vessels from the adrenal glands. All right, and the parasympathetic side of things, this is time to slow down. Yes, it's time to take a nap in my favorite slipper. Now we talk about the peripheral nervous system. Now we're talking about out here. So in that peripheral nervous system, you have two different types of nerves, sensory nerves and motor nerves. Sensory, just like it sounds. I'm going to sense something. I'm going to tell my brain what it is. My brain is going to remember what it is, and it's going to tell my body to do something about it. So impulse goes from my finger to my brain. My brain sends the impulse back to my muscles. So the motor nerves are transmitting those. All right. So now, moving away from neuro, let's move to the skin, the integumentary system. This is the largest organ of the body. You think about it, you can see the largest organ of the body every day. We do, but think of why it's the largest. Take the skin off, put it in a pile next to the other largest organ in the body, not even comparable. What does the skin do? This helps regulate our body temperature, senses heat, cold, touch, pressure, and pain, transmits all that information from the environment out here up to our brain. And it protects the body from environmental organisms. So when we have a burn patient, that their skin has been removed by fire or heat, by a thermal burn or a chemical burn. So that protective layer has been removed. So now they can't do this. They can't regulate their body temperature. So we have to keep them warm. They lose a lot of fluid. So we have to replace that. They are very prone to infection, because they don't have that protective layer that protects their body from the germs in the world. So being the largest organ in the body, what is it made of? Well, there's layers of the skin. You have the epidermis. This is the outer layer. This is the layer you see. That's there for protection. You slough off the epidermis. Literally, I have standing here doing this presentation right now and have lost thousands of epidermal cells into the air just by happening. That's what the body does. So, and then the dermis, this is the middle layer of skin. This is where the nerve endings, the blood vessels, and hair follicles, that's where they live. All right, then we get down below, we talk about the subcutaneous level. This is sub, meaning under the dermis. So this area is mostly fats, and it is insulation, and it's where the energy reserves are. So think about the skin and it's covering muscle. So we used to at one time give subcutaneous shots as an emergent for epinephrine. And I found that because we were putting epinephrine into the subcutaneous layer of fat, it literally wasn't, I mean, with the vascular that went through there, it wasn't absorbing. And then they're like, oh, well, we should have known that. And then they changed it to an IM shot. So we're actually getting through this layers of skin and into the muscle that the skin covers with that hypodermic needle. All right, now the digestive system. And you know what? The digestive system, everybody has their poop story. We'll share that for another time. But what does that do? This is an important system. It starts by adding enzymes to any food we take into our body. Then those enzymes, they will speed up the chemical process for breakdown. And then these enzymes are all created by different areas of the digestive system. So the salivary glands, the stomach, the liver, the pancreas, the small intestine, and they convert foods into basic sugars and fatty acids and amino acids. So our body can function. So basic sugars for energy, fatty acids and amino acids, depending on what muscle repair or energy or basic body maintenance for just being alive. That's why if a digestive system is not working one way or another, because we didn't take care of it, it will let you know. All right. So where does it start? Digestion starts as soon as a piece of food. Actually, you know what? It starts even before that. Because if you think about this, Mr. Pavlov, doctor, did an experiment with a bell and a dog. He rang the bell, the dog would be like, and gave the dog a treat. And now every time he rang the bell, the dog would start salivating because it knew it was going to get a treat. We're the same way. We can look at food while we go out to dinner and man, I went to the barbecue joint and I smell those ribs cooking. I am salivating. I'm like, holy moly, that's going to be good. So we actually even starts before that. So in preparation of intaking the food in the mouth, the body starts preparing for that by increasing salivation. So now we put food in the mouth and we chew that. We chew that, we prepare that for it to go through the oral pharynx and through the pharynx down into the esophagus. So if you remember back when we talked about airway, in the trachea, which is anterior to the esophagus, and the esophagus is posterior, the trachea had those little rings made of cartilage. Well, the esophagus looks like it has rings too, but these are made of muscle. And when we swallow a bolus of food down, the esophagus, the muscles in the esophagus push the food all the way down to the stomach. In the stomach, the enzymes and the acids break down the food. That's where it starts working. So if you're not taking care of yourself, or if you're like, oh, that pizza was so good and I ate way too much, and you start to taste that acid, means that you have that regurg. But that's what is happening. You're actually tasting those stomach contents if you ever after eating too much pizza. So, but that's what's happening. That acids and the enzymes are starting to break that food down, because what the next step is going to be is going to move it into the small intestine. And in the small intestine, this is where 90% of the digestion and absorption happen in the body. So all the nutrients that you're taking in through food is gonna happen in here. So the main function of the small intestine is to absorb nutrients and minerals. So digestion is huge, but eating a good, healthy diet helps support this function. And when we work EMS, good luck with a healthy diet, because you know what? It's so easy to go to the local corner convenience store where the pizza is readily available and do that. So cognitive choices when we're working, because we don't take care of ourselves, we don't get gray. So when we get gray, hopefully we've taken care of ourselves where we got past this part. So soapbox done. I'm done. Here we go. Moving on. So remember, main function, absorbing nutrients and minerals. So then it moves down into the large intestine. Into the large intestine, the main function of the large intestine is to absorb water and electrolytes. So this is a process that isn't like, oh, we're going to stop here and totally function it in the small intestine. Then we're going to move everything down to the large intestine. This is a constant process that is just happening and happening as it's flowing through. So, and then also in the large intestine, after all the nutrients have been removed and they've gotten all the water and the electrolytes it needs, it's going to transport the waste material that it doesn't need out through the rectum. So passing through. So when we look at the digestive system, it is such an important part of the function of our body. We can't live without our heart, but we'll die like that. We can't live without our lungs, so we'll die like that. We can't live without our digestive system. We won't die like that, but it will affect everything else in our body. So that's huge. And when we look at the digestive system, we look at the abdomen. So the anatomy of the digestive system, well, we got to talk about the anatomy of the abdomen because there's more than just the digestive system down there. So when we look at anatomical areas of the body, we talk about the abdomen as in quadrants. So we have the right upper quadrant, the left upper quadrant, the right lower quadrant, and the left lower quadrant. So in the right upper quadrant, this is where the liver is. This produces biles, it breaks down fats, filters blood and from the digestive system, detoxifies chemicals, metabolizes drugs, stores glycogen, vitamins, minerals. It's a solid organ. So when it's a solid organ, it's full of blood vasculature. If it's full of blood vasculature and it's injured, that could be bad because a lot of bleeding can happen. So same with the spleen. This is located in so that the liver is located on the right upper quadrant area, kind of big, kind of goes over to the epigastric area. And then the spleen, that's located over on the left, upper left side. That's also a solid organ. This is designed for filtering blood, but it's very susceptible to injury from blunt trauma. And it can lead to severe internal bleeding where they have to remove it, or contusion or everything else. So keep that in mind. And then the pancreas. We have the pancreas. This is another area that releases digestive enzymes, but more importantly, it produces hormones like insulin and glucagon to control the blood sugar. So this is the organ that's affected by a type 1 diabetic. So it's not producing insulin anymore because of usually an autoimmune problem that has attacked those insulin producing cells. So, and then moving from because we're talking about the abdomen, this is part of the endocrine system. So this is the endocrine system is a control system for the body. This is produce and secrete hormones. And the hormones, what do? They're the chemical substance that regulates activity of organs and cells in the body. This regulates growth, your metabolism, and your sexual development. In there, we look back at the pancreas. This is the upper left quadrant, secretes enzymes to break down proteins, fats, lipids, carbohydrates, and then insulin and glucagon, which we kind of talked about, just a part of the review. So, and then the thyroid gland. Thyroid is a hormone. It regulates metabolism and growth. So it's very, very common for patient populations to have hypothyroid, which will cause all sorts of other medical problems that are associated with that. So they'll take thyroid balancing medicines. And then on top of the kidneys, you have the adrenal glands. The adrenal glands, just how they sound, adrenaline, right? This is where they produce that norepinephrine and an epinephrine. They also control blood sugar and burn protein and fat in the adrenal glands, and controlling all of that. It also produces cortisol, which regulates metabolism and as a reaction to stress, and then produces aldosterone to regulate that blood pressure. So remember, when we talk about the urinary system, that's why they're on top of the kidneys, because we're regulating the blood pressure with the aldosterone. So good. And then we talk about the master gland, that pituitary gland. It produces a whole ton of hormones, and those hormones are designed to regulate the other glands that will also release hormones. All right. So moving into the urinary system, which is a big portion of controlling this. This can obviously, we know the kidneys are there to filter our blood and remove fluids and balance, and the controls that fluid balance in our body. This filters and eliminates wastes, controls the pH balance of our body, and it helps regulate the blood pressure by the adrenal glands, by aldosterone, right? So that's part of what they're doing. So kidneys, they're designed to remove toxin and other waste products. They do that and then they expel as urine. So now moving down into the genital system for female and male, this controls the reproductive process, which each one of these areas we're talking about has a system that we'll go through during EMT class. All right, let's review. What type of muscles are under conscious control? You said skeletal, right on. In what digestive organ does most digestion and absorption occur? Remember, most digestion and absorption of those nutrients happen in the small intestine. Which is the complex message control system that integrates many body functions? Endocrine, very important system. All right, what is primarily responsible to regulate water and blood pressure? Water and blood pressure. Urinary system. The largest part of the brain is the, what did I say? Otherwise known as, what did you say? I heard that it was the cerebrum. All right. Insulin is produced where? If you said pancreas, that's because you're smart. Because that's right. Which gland produces epinephrine and activates the sympathetic nervous system? Epinephrine sounds like adrenaline, must be the adrenal gland. Which of the following is not an effect of the sympathetic nervous system? So remember, digestion is actually, increased digestion is controlled by the parasympathetic nervous system, or that feeding part. What organ produces bile, filters blood, detoxifies chemicals, and stores glycogen? Liver it is. Which of the following is not a function of the skin? Gives the body its shape. The skin's there, but you have your muscles in your bones that are doing that. What is the outermost layer of the skin? The outermost layer, epidermis. What layer contains the hair follicles, blood vessels, and nerves? Well, that's the dermis. Nice job. The cartilaginous tip, I say that 6 times fast, of the sternum is called the xiphoid process. So that's made of cartilage. A person with bilateral femur fractures has fractured both, because we're bilateral. So you should, if you've done your medical terminology, that's where that should have come from. There you go. The medial aspect of a bone is that part of a bone that lies. So medial, remember medial is midline towards the center of the body. A person is found floating on his stomach in a pool. If he's floating on his stomach in a pool, that is prone. A term used to describe a part of the body that is closer to the head than another part is called superior. Movement away from the body is abduction. Think of aliens. The anterior surface of the thigh is, so think anterior, that's the front of the leg. Your patient is unconscious and breathing adequately. You position him on his side. This is called the laterally recumbent. And then you add a right or left, depending on what side you put him on. What type of blood vessels carry blood away from the heart? Nice job. It's arteries. Nice work. All right. So, great job. We will see you on the next one.